Greetings, colleagues. My name is Desireh, and welcome to this first episode of the CPD Bites on managing period pain in the community pharmacy. In this episode, we will cover the management of primary dysmenorrhea in the community pharmacy. Our learning objectives today are to understand the etiology, signs, and symptoms of primary and secondary dysmenorrhea, to differentiate between primary and secondary dysmenorrhea, to effectively cancel and support women presenting with dysmenorrhea, and to effectively manage pain in primary dysmenorrhea within the community pharmacy setting. Dysmenorrhea refers to painful menstrual cramps and is classified into two types: primary dysmenorrhea, where there is no underlying pathology, and secondary dysmenorrhea that is caused by an unidentifiable medical condition. Some classical differences between these two types of dysmenorrhea include that primary dysmenorrhea usually has an onset of 1 to 2 days before or with the onset of menstruation and lasts about 2 to 3 days. The pain that comes from primary dysmenorrhea is usually around the lower abdomen and is often described as cramping, sharp, or throbbing. The pain from primary dysmenorrhea may radiate to the lower back, thighs, or groin. Additionally, some systemic symptoms of primary dysmenorrhea include nausea, vomiting, diarrhea, headaches, and fatigue. On the other hand, secondary dysmenorrhea often starts earlier in the menstrual cycle and may last longer than primary dysmenorrhea. It also may worsen as the menstrual cycle progresses. The pain from secondary dysmenorrhea tends to be more severe and less responsive to over-the-counter pain relief than in primary dysmenorrhea. Women with secondary dysmenorrhea may experience pelvic pain outside of menstruation, depending on the underlying cause. And some additional symptoms that may occur with secondary dysmenorrhea depend on the condition that is causing the secondary dysmenorrhea, and may include heavy menstrual bleeding, painful intercourse, or irregular menstrual cycles. When it comes to counseling approaches to support women with dysmenorrhea, there are several counseling approaches that are recommended. The first one is psychoeducation, which involves educating women about menstrual pain, causes, and its management. This has been shown to reduce anxiety and promotes self-care behavior. Secondly, we have cognitive behavioral therapy, which involves reframing the negative thoughts and behaviors that women have around pain. It includes aspects such as cognitive restructuring, behavioral activation, and relaxation techniques, and it has been proven to reduce pain intensity and improve the quality of life. The third approach is mindfulness-based stress reduction, which focuses on mindfulness techniques to manage pain and reduce emotional distress. It includes meditation, body scanning, and mindful breathing, and this has been shown to decrease pain severity and stress levels for women with dysmenorrhea. Fourth, we have lifestyle counseling, and this includes counseling on physical activity and dietary adjustments. Physical activity may involve encouraging clients to regularly do light to moderate exercises such as yoga, walking, and this has been shown to reduce pain. Additional dietary adjustments such as consumption of anti-inflammatory foods such as tomatoes, olive oil, green leafy vegetables, nuts, fatty fish, and fruits, and reducing caffeine or alcohol can also help in reducing the pain associated with primary dysmenorrhea. Finally, we have social and emotional support, And this involves having support groups and educating family or partners to help reduce isolation and improve coping when it comes to primary dysmenorrhea. Emotional support has been linked to lower pain levels and better outcomes for women with primary dysmenorrhea. Pharmacological treatment for primary dysmenorrhea includes the prescription of nonsteroidal anti-inflammatory drugs and hormonal contraceptives. Nonsteroidal anti-inflammatory drugs like ibuprofen are effective in reducing prostaglandin production, and this alleviates pain in primary dysmenorrhea. They have been shown to be very effective, and a summary of the appropriate initial doses and subsequent doses, as well as the adverse effects of NSAIDs, can be found in the table below. Hormonal contraceptives can regulate or suppress ovulation, thus reducing the severity of menstrual cramps. Prescription of contraceptives will vary from woman to woman, and a thorough assessment of the eligibility criteria is recommended. When it comes to non-pharmacological treatment for primary dysmenorrhea, it involves lifestyle modifications such as regular physical activity, stress reduction, and certain dietary adjustments such as reducing caffeine and alcohol that may help reduce pain symptoms. Additionally, fennel, ginger, cinnamon, topical heat, and acupuncture are useful natural remedies that can reduce pain symptoms. In summary, primary dysmenorrhea refers to painful menstrual cramps that have an unknown etiology. It often presents with nausea, vomiting, diarrhea, headaches, and fatigue. Some counseling approaches for women that are useful include psychoeducation, mindfulness-based stress reduction, cognitive behavioral therapy, lifestyle counseling, and social and emotional support. Pharmacological management involves prescription of nonsteroidal anti-inflammatory drugs that are very effective in managing primary dysmenorrhea. Additionally, non-pharmacological approaches such as lifestyle modification, natural remedies are also recommended in managing primary dysmenorrhea. Thank you for watching, and we hope this episode has been helpful for you to support the management of primary dysmenorrhea in your pharmacy. To learn more about secondary dysmenorrhea and how it can be managed, please watch the next episode in this series.